Ladies and gentlemen, today I will share with you the Guasa technique with the assistance of the molecular reform therapy for a better health. Today I will share with you the general knowledge of Guasa. You need an 𝐻𝐿𝐾𝐿 Guasa board and an 𝐻𝐿𝐾𝐿 Guasa oil. This is a Guasa board and the top part is a tape board, which is normally used on the body without oil or without taking off your shirt, whereas the other part is a thinner part that is normally used for treatment. The corner is only used for acupuncture treatment according to the diagram. The correct way of holding the Guasa board is to hold it firmly at your palm. Place the board 45 degrees and scrub it firmly downwards. Press down firmly and scrub it in one direction only. For the arm, it's the same. Hold it 45 degrees, scrub downwards for about 25 times. When Guasa for elderly or weak people, we use the lesser strength to Guasa or scrub them. Slow pace and lesser strength will be just nice. We don't use strong force on elderly people. For a strong and a well-built body, we use a stronger force and faster speed. Consistent strong force and faster speed to Guasa them for about 30 times. The hand also the same, consistent strong force and faster speed. But for ordinary people, we use a strong force but a slower speed to Guasa them for about 30 times. Even the hand, we use the same thing in one direction, Guasa them 30 times. Strong force but slow speed as you seen in the diagram here. Strong force, slow speed. Strong force, slow speed until you see a patches of SAR. Use the edge of the Guasa board or the corner of the Guasa board on your area like your kneecap or your elbow. You Guasa accordingly as you can see in the video here. As for the body, Guasa consistently about 25 times from the top to the bottom until you can see the SAR appear. That you can see in the diagram here. Before you Guasa, put some 𝐻𝐿𝐾𝐿 Guasa oil onto the area you want to Guasa and even out the oil accordingly. After even out, then you can start Guasa from the top to bottom and from the hand from inside to outside, for the back of the leg from top to bottom. As for the eye area, just Guasa from inside the eye to outside, from inside to outside. For the head area, you can Guasa from the top of your head to the bottom of your head. For the chest area, you Guasa from the middle of the body to outside, from inside to outside, from inside to outside. That's all. At the middle of the body, just use from top to bottom. Just Guasa using the edge of the Guasa board and from top to bottom only. At the back of the body, start Guasa at the area of the backbone area. You Guasa about 25 times. Each area Guasa 25 times. Put some oil, Guasa consistently for 25 times until you can see the SAR appear. Then after that, use 2 fingers to measure to the left and right and start Guasa on the next line. 2 fingers after the backbone area. Just Guasa consistently 25 to 30 times until you can see the SAR appear. Just Guasa consistently. After doing the left side, you can do on the right side, distance of 2 fingers from the backbone area. The right Guasa technique is to place the Guasa board 45 degrees on the surface of the skin or the area you want to Guasa. For joint and elbow, use the edge of the Guasa board. For an effective Guasa, try to drag your Guasa or your stroke of your Guasa to the longest. Apply a small portion of 𝐻𝐿𝐾𝐿 Guasa oil to the part or area you want to do Guasa and then even out the oil. Then Guasa the part downwards about 25 to 30 times until you can see the red SAR appear. You might experience body ache after Guasa for about 2 to 3 days, especially for those who did not exercise for a long time. There is no side effect of Guasa. Please do not do Guasa 30 minutes before or after taking bath and taking a meal. And don't do Guasa in a windy area. After Guasa, please drink a glass of warm water.